As you are growing your medical practice, you may run into a lot of issues with how you're going to scale it and get to the next level. And this is something I struggle with trying to build out my virtual care company, SensorMed, and getting it to a point where we can deal with thousands of patients and hundreds of doctors. So as you're building out a medical practice or working with organizations, the key to understand is there are 4 levels you need to pull in order to get to the next level in anything. So the first thing, before you even think about scaling, you need to understand what you have, is it legitimate? That's the first thing. And how do you understand that? You need to really deep dive into see if this is working. And how do you know that? So if you have a solution, a service, or if you're in a community and you're building out work for patients in the community, if you're offering something that is really insightful, helping them, they're doing word of mouth marketing, talking about your product or service, you should see growth, right? Anything that is healthy will grow, and you'll see that your business is healthy because you have the right offer to the community that you're servicing, or you have the right opportunity and you have ability to get them access to what they need. A lot of times businesses are not successful because they don't have a problem they're trying to solve for their community that they're trying to solve for. So for instance, we work with a lot of doctors in rural communities. A lot of times they've been there forever, they know everyone. The doctor probably has birthed everyone in the community. They probably know all their ailments. And so that is someone that's embedded in the community and knows their needs. If you're trying to start a new program in this day and age, especially in the healthcare space, you need to understand what community you want to go after and what is going to be that unique opportunity that you're offering them. The thing we see work well is someone offering something specific to demographics, right? If you focus on African Americans or the Spanish community, right? This is be key to kind of help understand their needs in special cases. Or we've seen a outgrowth in a lot of women health clinics, right? We're seeing a lot of people start those out, or men health clinics specific to a gender because each gender may have unique things that they're kind of suffering from. So make sure you're very specific on the market you're going after, and then making sure you're servicing them at a high level so that they can get what they need. So now that you're seeing results, so that means every month you're seeing some growth, more and more patients coming in, you're seeing more and more revenue coming in. Now, let's start to scale that, because if it works, then you need to double, triple, quadruple down on what works. So here are some suggestions. Take this mental mind frame. Understand the 2 P's and the 2 C's. That's right. First, the first P, you need to really understand people. People help you scale. That's just a fact. If you're starting a medical practice or any kind of healthcare related business, having people can help double, triple your output, because a person can do more with multiple people involved. So for instance, in our company, when we started it, it was just me and my co-founder, but then we started to add more people to it. So pieces that I was doing before, I started to broker off to other pieces. So I used to do all the invoicing. So now I have a team member that does that. Now that time has freed me up to do other pieces of the business that can help me grow faster. That's what scaling allows you to do. It allows you to free up, delegate to other individuals tasks so that you can focus on continual growth. And that's what you need to do. So leverage the first P, people. And it doesn't have to be full-time individuals. They can be virtual assistants. They can be in the medical field, medical assistants, right? Who can help you in various tasks, from scribing to helping with patient intake to helping with patient outreach. Use these resources so you can scale and you can use more of your mind power to understand how to grow the business. So that's the first lesson, people. The second P, 2 P's, the second P will be focused on product. So product can mean a lot of different things to different people. For us and the people I talk to, is really about understanding technology and code. How do you scale things with using technology? Because technology helps you automate. They make you do things a lot faster. So for instance, if you build a piece of software once, typically that software will always do the same thing it does always. And this is an economic term where they say marginal costs are 0. So basically you spend a lot of money up front to build it, but then every incremental unit that you get from it is $0. And that's why it's so powerful in scaling. So for instance, you don't have to think about code, but you can think about calculators or some sort of guides that kind of guide people to better solutions and better opportunities. For instance, we work with clients on billing, so we put together a program that allows us to understand how best to treat your patients and what you can expect from a reimbursement standpoint. So putting that together, these calculators, these tools, help you scale yourself way more than if you did it on your own. So that's the second P, is product. Understand that and you can scale your business to the next level. So let me take a moment to say, hey, let me know if you're implementing these tools to help scale your business this year and how they affect you. If you like this content, please take the time to subscribe, comment, and like below. And I'll have more content like this in the future. All right, let's get into the 2 C's. The first C is all about content. That's right. You have to create consistent content that's going to draw your avatar in. I mentioned before, under being clear on who you're offering your product or services to. So for instance, if you're targeting a women's health clinic, you want to make sure that you're communicating to them effectively with content. You have to do call outs. You have to understand their pain points and be specific, and being consistent in content helps you do that. You build it once, always have the messaging out there. That's why we do a lot with social media. We put a lot of content out there so we can call out to doctors, nurse practitioners, medical practice owners to let them know opportunities to grow revenue here in this year. And the goal is you want to make sure you're consistent with that. So you built this once and you keep posting it out there. So over time, that builds over time, so more and more people see it and they understand what you bring to the marketplace, and if you have a product or solution that can help them with their specific problem. And then last but not least, we get into the last C. The last C is capital. Yes, we are in a capitalistic society, and to grow a lot of things, you need money in order to do so. A lot of times it could be startup capital, so you can begin the initial phases of building out your medical practice. You need help with marketing, you need people, you need code. That takes capital. A lot of times you can leverage that more capital to get additional capital. For instance, using some capital, you'll be able to get more sales, and that sales can help generate more revenue for your business or your medical practice. So this is something that you need to really focus in on in order to help grow. For instance, my business, we were able to attract capital for venture capitalists from friends and family. Likewise, if you're building a small business or a medical practice in different areas, you can get an SBA loan or you can get a bank loan to get started, because that capital will allow you to scale your business a lot faster than if you did it on your own, bootstrap it. Because unfortunately, you may not have enough capital to even start the business. So it's really important that you focus on also getting capital, because once you have the capital, now it makes a lot of other things that we talked about a lot possible. So let's talk about what we discussed here, the 4 areas. First, you want to talk about people, making sure you have the right people in place in order to be successful. Second, you want to have the right product, having products that can automate systems for you consistently. You build it once and you build it over and over again. So this is something that you want to leverage more and more often. Then second, you want to make sure you understand content. Understanding once you create content, you can continually put that message out there and it stays out there, especially with social media now. Leverage content more and more effectively. And last but not least, capital. Having cash helps you build out these other leverage opportunities so you can scale faster. So understand the 2 P's and 2 C's to scale any business. So try it out in your medical practice, your clinic, as you're building out your healthcare business, and let us know in the comment section how they are working for you. So if you like this, please like and subscribe, and go check us out next time when we have more content on how to grow your medical practice.